Good afternoon, I'm Daniel Rigamonti. I'm the Salisbury Family Professor of Neurosurgery at Hopkins. I would like to talk to you about pseudotumor cerebri. When intracranial pressure, ICP, increases uncontrollably, it causes severe headache and blurred vision. And when this occurs in the absence of an intracranial tumor, the process is called pseudotumor cerebri syndrome, PTC syndrome. If the process goes unrecognized for too long, the patient may lose vision, sometimes completely. We now are familiar with some of the causes of this process. Stenosis or narrowing of cerebral venous sinuses, thrombosis of the sinus due to hematological diseases, certain medication, morbid obesity, all may lead to pseudotumor cerebri syndrome. Success in the management of PTC depends on the early recognition of its cause and its elimination. When, in spite of the most aggressive medical, radiological or intravascular treatment, ICP remains elevated, then shunt surgery is offered as a last resort. Although I intellectually knew about the risk to the vision that this condition represents, I didn't know firsthand how rapidly devastating this condition can become. That fact became tragically clear the day I received a frantic call from a colleague of mine in Virginia regarding a young school teacher who, because of a rare hematological condition, had thrombosed her cerebral sinus and lost her vision. In spite of an emergent transfer and surgery, I could not save her vision. What I learned from this tragic experience is that the surgical procedure is only a moment, although important, in the management of this condition. What is critical is the coordination and communication between different specialists. Since then, along with my colleague, we have strived to provide the best possible care to this patient. We also looked at outcome, tested new and better hardware, critically studied the complication associated with surgery to help improve both the diagnosis and the treatment of PTC. Today, we are striving to select the appropriate therapy for each patient, and we provide counseling as well as the surgical option. Thank you.